Alternatives to blood transfusions next on Caucus, New Jersey.
Funding for this edition of Caucus, New Jersey has been provided by Englewood Hospital and Medical Center, Verizon Communications, QualCare Inc., a local managed care company covering 750,000 New Jersey residents, and by New Jersey Natural Gas, proud to support education in our communities.
Welcome to Caucus, New Jersey. I'm Steve Adubato. An increasing number of patients undergoing medical treatment object to receiving blood. Joining me here in the studio to discuss what many are doing to reduce the risks and costs associated with blood transfusions are Dr. Arieh Shander, Executive Medical Director of the Institute for Patient Blood Management at Englewood Hospital Medical Center in New Jersey, Dr. Lawrence Tim Goodnow, Director of Transfusion Services at Stanford University Medical Center in California. Adam Solomon has undergone 2 bloodless medical procedures in 1995 and 2009. And finally, Dr. Arnold Friedman, Chairman of the Department of Obstetrics and Gynecology at Beth Israel Medical Center in New York City. I want to thank you all for joining us to talk about this very complex issue. Throughout this program, you'll see our website up. We can do only so much in this half hour on public television. And we want to try to provide as much information for you to go to the website. Doctor, let me ask you, we're talking about a very complex issue. Why is this an issue, and who is it most relevant for?
Well, you can divide it into 2. The first issue, of course, is a patient for whom blood is not an option. For example, Jehovah's Witnesses. There may be other situations where patients cannot receive blood either for medical reasons or because blood may not be available, such as trauma in a very remote area. The issue, of course, for the public is the concern that people have with risks of allogeneic transfusion.
Of what?
Allogeneic transfusion, which is bank blood, essentially. These risks, again, that the medical community is aware of, slightly different than what the public is concerned about. But there's also the fact that the cost of transfusion right now is also on the map for many institutions. And the reason, again, is the question of benefit of the amount of transfused blood that's going on in the medical community, and the benefit of it, and now the cost is a third element.
So when we use the term bloodless medicine, is it an accurate term?
Well, one component of this is blood management, and the way I define blood management is delivery of health care for the patients with appropriate use of blood and blood components with a goal of minimizing their use. So if your goal is 0, that would be bloodless medicine, right. But bloodless management is part of the whole package for all the patients.
And Doctor, you've told our producers, Dr. Friedman, that training is critical, that physicians really need to be trained to do this, and we can't assume that any physician would know how to do this. Go ahead.
Well, more than how to do it, the issue is whether to do it. And I think that medical schools today teach very little about the appropriate use of blood and blood products. I think there's a culture that goes back many, many years wherein blood transfusion, blood products are thought to be life-saving, and there's almost an aura around them. And no one has really, until recently, spent a lot of time talking about the appropriateness of when to use it.
Is there a movement in the country to take this effort much more seriously? Are we playing catch-up now?
I think to a degree we're playing catch-up in that this has gone on for many, many years, to the point where I think the 3 of us would tell you that there is more blood used than is absolutely necessary to use.
More blood used than is necessary.
Correct. And so the catch-up part is to bring people up to speed and to take the evidence that now exists in the medical literature and apply it to the appropriate use of blood.
Adam, you had severe bacterial infection.
Yes.
You visited a dentist.
Yes.
And you had a problem. You penetrated your spine, you were unable to walk, and you're a Jehovah's Witness.
Yes.
And that was that 95?
No, this was the recent one in 2009. 95, I had a herniated disc.
You had 2 surgeries?
Yes.
Both bloodless?
Right.
Describe it for us.
Well, the one in 95, I said, was a herniated disc. I hurt that I slipped and I fell on ice. But the one I had last year in 2009 was the one when I went to the dentist for a dental cleaning. 6 days later, I couldn't get out of the bed. My back was killing me. I was taken to the hospital, and it was diagnosed that I had a bacterial-borne blood infection. And the infection went to the lower part of my spine, and that's why I was having so much pain at that particular point. I was told by the staff that I would get better, but that the final results of what this infection did would take at least a year. And so over that period of time, I was going to physical therapy, but as the time went on, year after year, I started to get more pain in my legs and in my back. And then in 2009, last year, one day I came home from work and I couldn't move. I went to the doctor, and they gave me an emergency MRI, and it showed that my spine had deteriorated greatly.
So the bloodless surgery was critical for you?
Yes, it was.
Doctor, talk to us. How common is Adam's experience?
Well, in terms of bloodless surgery, it is not common. Most of our experience in medicine comes from treating the Jehovah's Witness community, where blood is not an option for religious reasons. We have actually expanded our application now in terms of understanding the physiology and how to do this to everyone, so that we can conserve blood as a resource and to not expose patients unnecessarily to blood transfusions.
Let's stay on the blood transfusion issue, because beyond the religious issues, the Jehovah's Witness issue that you're talking about, people perceive that blood transfusions are connected to a variety of risks. Let's go through them and tell me where we are. AIDS, hepatitis, correct?
They perceive that as being a risk. In fact, those risks are extremely low today. Again, thanks to the ability to detect those in blood and the donor blood, and remove any risks, if you will, at least in the Western Hemisphere. That's being done routinely.
What are the other reasons why people do not want to have blood transfusions?
Well, the public's, I think, reasonably correct in being concerned about emerging pathogens. All the way back to hepatitis and HIV several decades ago, we're always vigilant. West Nile virus would be a more recent example of something that's transmissible not only by organ transplant but by blood. And so the concept of blood carrying a risk is inherent, and the public recognizes that, and we recognize that. I run a blood bank. I dispense blood products to physicians when they recognize a patient need, but I also help patients and physicians devise strategies to avoid a blood transfusion. And it starts with informed consent, a conversation with the patient about what we know about the risks, what we don't know about unknown risks, what the perceived benefit would be, critically the alternatives to blood, which could be the patient's own blood, it could be a directed donation, or it could be no blood, alternatives. And then an opportunity to answer questions and consent. That's the very heart, that's the beginning of blood management.
You know what's interesting here is I'm thinking about this. I wonder the degree to which people, the average person, understands bloodless procedures. How much of your time, doctor, is spent, and your colleagues, is spent educating and informing citizens who are considering a bloodless procedure? What is really involved? How much time is involved in education?
Well, there's an awful lot. It needs to be done well. It needs to be done on a regular basis, but not only for patients who are contemplating a bloodless procedure. I think it's got to be done for everyone. Anyone who is undergoing a surgical procedure, for instance, needs to know the pros and cons of blood transfusion, the risks versus the benefits.
So how much of that went on for you?
Well, as I said, as one of Jehovah's Witnesses, that's my first concern, to abstain from blood. But as a consumer, I want the best that I can get, and when it comes to a blood management program. And thinking about the surgeries that I went through was bad enough, but let alone now having to be concerned about, you know, somebody else's blood in my body.
How did you communicate this afterwards, Adam, given the experience you had, given your beliefs?
Yes.
Those around you in the Jehovah's Witness community who are friends of yours, who know what you've been through, what was the message, what is the message you've communicated to them about this whole issue?
If you're looking for that particular type of health care where you don't have to worry about blood being an issue, and that blood management is done in a way that you as a patient can talk with the hospital instead of feeling that you're, you know, they don't care about your views. I would suggest that you look for that hospital.
Let me ask you, Doctor, let's go through some specifics here. I want to talk about the most specific innovations, if you will, and procedures connected to bloodless medicine, if you will. I'm going to go through some things. You tell me what they are. What's a volume expander?
A volume expander is a fluid.
By the way, excuse me, all of these terms are going to be listed on our website, and I just want to make sure you understand that we can only cover so much. The rest will be followed up on our website. Go ahead. We're talking about volume expander.
Volume expander are fluids that we use to infuse into the patient's veins, if you will. Instead of having just blood, there is either water component or something called starch that we use, which is a liquid, and that liquid helps circulate the blood in your veins, essentially. What
is a cell saver?
Cell salvage is a process.
Cell salvage?
Yes. Cell saver is actually a commercial name, but cell saver.
Let's not go with the commercial name.
That's fine. Cell salvage is a process by which we collect shed blood from the wound. Instead of throwing it away, we collect it in a sterile container. It's usually has a blood thinner in it so it doesn't clot, and we then wash this blood and remove the cells that have been injured and return this back to the patient.
Okay, Dr. Goodenow, walk us through the process.
Well, an important place to start is in the preoperative setting. If you have time and you have an elective situation, get a blood count on the patient up to 30 days before the scheduled surgical procedure. Because you can diagnose anemia in a patient, which puts them behind the 8 ball already in terms of maybe needing blood or not being able to tolerate a given amount of blood loss. And they might be iron deficient. A very common situation in men and women, both. And so you can diagnose the anemia and you can evaluate and manage the anemia. If it's genuinely elective surgery, there's no reason why that surgery couldn't be postponed if necessary. Get the blood count up into the normal range before the surgical procedure.
A little bit